Heart disease remains the leading cause of death in the United States. What's even more shocking, many cardiovascular deaths are linked to undiagnosed artery blockages, which often show early warning signs if we pay attention. Your arteries don't just suddenly close overnight. They send distress signals long before a heart attack or stroke occurs. The problem is, most people mistake these signals for normal aging or dismiss them as minor inconveniences. Imagine missing a family moment because you ignored your body's whispers. Today, I'm going to reveal the 10 critical warning signs that your arteries are blocked, signs that your doctor wants you to know about. Your body has been trying to tell you something important. When your circulation system faces trouble, it operates like a sophisticated warning system, sending distress signals long before a crisis hits your arteries. Think of it as an internal alarm system that starts ringing softly at first, then grows louder as danger approaches. The problem is that most people don't understand what these alarms mean. Over years, cholesterol and calcium build up inside your vessels, narrowing paths for blood flow and triggering subtle alarms. What makes this particularly dangerous is that you can't feel it happening. The majority of individuals ignore these early warnings, mistaking them for normal aging or stress. They blame their shortness of breath on being out of shape. They dismiss chest tightness as heartburn. They explain away their fatigue as working too hard. The science behind why arteries send these specific signals becomes clear when you understand blood flow mechanics. When an artery narrows, your heart must work harder to push blood through the smaller opening. This creates pressure changes throughout your circulatory system. Your body responds by triggering various symptoms to alert you that something is wrong. Different blockage locations create distinct warning patterns throughout the body. A blocked coronary artery produces chest pain and arm discomfort. Carotid artery problems cause dizziness and vision changes. Peripheral artery blockages trigger leg pain during walking. Each location sends its own unique distress signal. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. Blockages worsen slowly at first, then accelerate, giving you windows of opportunity to notice and act on symptoms. Medical research shows that early detection can prevent 80% of premature heart attacks and strokes. The key is recognizing these signals before they become medical emergencies. Your body uses 10 specific signals to communicate arterial danger, and each one provides valuable information about what's happening inside your circulatory system. Understanding these signals transforms you from a passive victim to an active guardian of your heart health. Instead of waiting for a crisis, you become empowered to take action when problems are still manageable. But which of these 10 signals is most likely to slip under your radar? We'll cover it next. The first warning signal that catches most people off guard involves chest discomfort that doesn't match what they expect from heart problems. Chest pain from blocked arteries doesn't always feel like the dramatic Hollywood heart attack you've seen in movies. Angina may feel like pressure, tightness, or a squeezing ache, often mistaken for heartburn or muscle strain. Many people dismiss angina as indigestion or stress without realizing it could be their heart signaling danger. The pain doesn't always announce itself with sharp stabbing sensations. Instead, it often feels like indigestion after a heavy meal or muscle soreness from lifting something heavy. This similarity leads people to reach for antacids or heating pads instead of seeking medical attention. Angina follows specific patterns that reveal important information about your arterial health. The discomfort typically starts during physical exertion or emotional stress. It radiates from your chest to your arms, neck, or jaw in predictable ways. Most importantly, it subsides when you rest or calm down. This characteristic pattern helps doctors identify arterial problems before they become emergencies. Heart attack pain operates differently and creates a true emergency. Unlike angina, heart attack pain persists even when you're sitting still or lying down. The pain doesn't respond to rest or relaxation. That ongoing pain that won't quit at rest is usually a red alert. Call 911 immediately. It often comes with cold sweats, nausea, and shortness of breath that won't improve with time. Location matters more than most people realize. Left arm pain typically signals problems with your main coronary arteries. Right arm pain can indicate issues with different arterial branches. Pain that radiates to your jaw might suggest blockages in specific coronary vessels. Each pattern tells doctors where to look for problems. Women may feel a brief sharp ache in the neck or shoulder instead of the classic crushing chest pain, which can delay diagnosis. Women often feel pressure rather than sharp pain. They may describe their symptoms as heaviness or fullness instead of the crushing pain that men typically report. Research reveals that many heart attacks produce minimal or no chest pain symptoms. These silent heart attacks particularly affect older adults and people with diabetes. The lack of obvious pain makes these events extremely dangerous because people don't seek immediate medical care. But chest pain represents just one piece of a larger puzzle. When your cardiovascular system struggles, it affects your entire body's ability to function properly. Shortness of breath and unrelenting tiredness aren't just signs of getting older. They're your heart crying out for help when blocked arteries can't deliver the oxygen your body needs to function properly. Reduced blood flow creates a domino effect of oxygen shortage throughout your body systems. When your arteries narrow, less blood reaches your organs, muscles, and tissues. This forces your heart to work harder while delivering less fuel to the places that need it most. Your body responds by rationing energy, leaving you feeling tired and breathless. Shortness of breath and fatigue often accompany atherosclerosis and warrant medical evaluation rather than acceptance as normal aging. The progression follows a predictable pattern. You first notice shortness of breath during intense exercise or physical exertion. As blockages worsen, everyday tasks like climbing stairs become challenging. Eventually, you might feel breathless while sitting or lying down, which signals severe circulation problems. Arterial blockage connects directly to unexplained fatigue that makes simple activities feel exhausting. When your muscles don't receive adequate oxygen-rich blood, they can't produce energy efficiently. Tasks that once felt effortless now drain your energy reserves. This fatigue differs from normal tiredness because rest doesn't restore your energy levels. Additional warning signs reveal widespread circulation problems throughout your body. Heart palpitations occur when your heart struggles to pump blood through narrowed arteries. Dizziness happens when reduced blood flow affects your brain's oxygen supply. Nausea often accompanies these symptoms during episodes of poor circulation. Cold extremities, particularly in your hands and feet, signal that blood isn't reaching your body's outer regions effectively. With peripheral artery disease, walking may trigger calf cramps that ease when you rest, a classic sign doctors call claudication. This condition causes cramping or heaviness in the legs during physical activities. The pain subsides when you stop moving because your muscles' oxygen demands decrease. Lifestyle interventions can actually reverse early arterial damage and restore energy levels. A heart-healthy diet with more fruits, vegetables, whole grains and beans, and fewer foods high in salt or saturated fat helps reduce plaque buildup. Regular exercise manages weight and reduces cholesterol levels. Quitting smoking prevents further artery wall damage. Managing stress through healthy coping mechanisms protects your cardiovascular system from additional harm. Modern medicine has developed simple, painless tests that can detect arterial blockages decades before they cause heart attacks. Doctors employ a comprehensive approach that combines patient history, physical examinations, and targeted diagnostic tests to assess cardiovascular health. This strategy becomes especially important for adults over 35, when arterial problems often begin developing without obvious symptoms. Coronary artery disease is the leading cause of heart attacks in the United States, yet most arterial blockages are detectable years in advance. This means that hundreds of thousands of deaths could be prevented if people understood the importance of regular screening and early intervention. Doctors combine blood tests, ECGs and stress tests to spot trouble, then use imaging like CT scans or angiograms to map blockages. Blood work provides the foundation by measuring cholesterol levels and cardiac markers that reveal plaque buildup and potential heart damage. Your cholesterol numbers tell doctors how much fatty material might be accumulating in your arteries. Cardiac markers indicate whether your heart muscle has suffered any damage from reduced blood flow. Electrocardiograms detect heart rhythm changes through a completely non-invasive process, revealing irregularities in your heart's electrical activity that may indicate underlying problems. Stress tests reveal hidden problems by monitoring heart function during physical exertion, allowing doctors to observe how well your heart handles increased demands for blood and oxygen. Advanced imaging techniques create detailed maps of arterial blockages throughout your body. These methods allow doctors to pinpoint the exact location and severity of blockages, guiding their treatment decisions with precision. Treatment progresses logically from lifestyle modifications and medications to surgical interventions like angioplasty and bypass surgery. Lifestyle changes often serve as the first line of defense, while medications help manage risk factors. Surgical procedures restore blood flow in more severe cases. For example, one active man discovered a 90% blockage on a routine scan and returned to his lifestyle 2 weeks after angioplasty and stenting. This discovery prevented a potential heart attack through early intervention. If climbing stairs leaves you winded or you have unexplained chest discomfort, schedule a heart check. Early tests can catch problems before they become emergencies. Understanding these warning signals gives you the tools to protect your cardiovascular health before problems become emergencies. Your arteries have been speaking to you all along. Now you have the knowledge to listen and respond before it's too late. Take action today by scheduling that overdue physical exam and discussing these warning signs with your doctor. A heart scan can be a quick and inexpensive test to determine your risk of developing coronary artery disease, potentially preventing a heart attack and saving your life. Remember the 10 silent warnings, from chest pressure to leg cramps, and put your knowledge to work at your next checkup. Every day you wait is another day your arteries may be silently narrowing, but studies show that a plant-forward diet and regular exercise can slow or even reverse early artery narrowing. Please check out our next video above. See you shortly in the next video.